Audio Jungle.
So what's the big idea? Well, the big idea is your central nervous system. Your central nervous system is made up of your brain and spinal cord and is continually monitoring and coordinating every single function in your body. If you think of the brain as a central computer that controls and coordinates all the functions of your body, then the nervous system is like a communication network that relays messages back and forth from the brain to different parts of the body via the spinal cord. The spinal cord is a long bundle of nerve tissue which extends from the lower part of your brain down through your spinal column. Along the way, smaller braids branch off from the cord and pass out from the spine between each of the movable vertebrae. These braids divide again and again into tiny nerve fibers and fill the entire body, going to each cell, organ, and tissue. Every human has an estimated 15 billion nerve cells, sending and receiving messages to the spinal cord. Now, our nervous system is extremely delicate, so what protects it? Our spine. This is what a normal healthy spine looks like. It has 24 movable vertebrae, each working with the one above and below it. A disc separates the vertebrae and acts like a shock absorber and a spacer for the nerve. So why is a healthy spine so important? Well, it protects the spinal cord and the delicate nerve tissue and allows us to bend, flex, twist and move freely without compromising the nerves. If the spine is not moving freely, it's referred to as a vertebral subluxation complex, or for short, a subluxation. This is when two or more vertebrae have lost their normal motion and or position. This can cause interruption to the normal nerve flow and interfere with the communication from the brain to the body and from the body back to the brain. Research at the University of Colorado found that it only took between 8 to 10 millimeters of mercury pressure to reduce the nerve supply by up to 60%. That's about the weight of a small coin. Compression can exist without pain, so that means where the nerve goes to can be robbed of up to 60% of its nerve supply and you may not even feel it. This is what is referred to as a silent subluxation. Even slight pressure on the nerves can alter the quality or quantity of the messages being sent.
It can slow it down.
It can speed it up.
Or it can distort the nerve messages to and from the brain. At the tissue and cellular level, the interrupted flow is sometimes inadequate for the demands of the body. As you've just experienced, when there's a communication breakdown, it's really hard to understand the message. So what happens when you have a subluxation? That area can start to degenerate in as little as 2 weeks. This degeneration causes scar tissue to develop, which leads to more scar tissue. This degenerative process can continue as long as the immobilization is present, and this type of degeneration is preventable. Spinal degeneration has nothing to do with how old you are. You can be 60 years old and have a perfectly healthy spine, or you can be 10 and have a spine that's already showing signs of degeneration. It all depends on how and when the subluxation occurred. Subluxations can interfere with normal communication between the brain and the body. So, for example, the nerve supply from your neck goes to the immune system, pituitary glands, sinuses, face, middle and inner ear, eyes, tonsils, teeth, neck and shoulder muscles. The nerves from your thoracic spine go to your arms, hands and fingers, heart, lungs, gallbladder, liver, stomach, pancreas, spleen, kidneys, small intestine and lymph glands. From your lower back, large intestine, appendix, abdomen, sex organs, uterus, bladder, knees, prostate, lower back and leg muscles, and that's just naming a few. Okay, so now you know where they go. What does that mean? Well, that's a good question. If the nerve supply to anywhere in the body is disturbed, it can eventually lead to a symptom. Symptoms are the only way for your body to let you know that something's wrong. So let's go back to the same spine again. If you have nerve interference in the cervical spine, it can lead to headaches, migraines, lowered immune system, sinus troubles, hay fever, abnormal sleep patterns, eczema, hearing loss, tonsillitis, chronic cough, croup, pins and needles into the arms and hands. In the thoracic spine, asthma, functional heart problems, bronchitis, influenza, gallbladder troubles, liver conditions, blood pressure problems, indigestion, heartburn, gastritis, lowered immunity, allergies, kidney troubles, chronic tiredness. In the lower back, constipation, menstrual problems, bedwetting, knee problems, sciatica, backache, poor circulation, swollen ankles, weakness into legs and cramping. Wow, I'm out of breath, and that's naming only a few.